going to be your nurse today. I'm here to do your head, eyes, ears, nose, and throat assessment. Can you tell me your name and date of birth?
Kaylee Rafalco, April 10th, 1989.
Awesome. First, I'm going to be looking at your head and neck. I'm just looking at symmetry of both sides, making sure I'm not seeing any noticeable facial drooping. Everything looks good so far. And then I'm going to do an inspection to make sure I don't see any like bulging or pulsation or anything like that.
Okay.
First thing I'm going to do is I'm going to be looking at your sinuses. So I'm just going to feel the front of your face a little bit.
Okay.
So I'm feeling your frontal sinuses, any pain, tenderness of that.
No.
And then maxillary. Any pain, tenderness?
No.
Okay, great. Next thing I'm going to be doing are your lymph nodes. So I'm just going to be feeling around your face and neck. I'm going to be starting with your preauricular, postauricular. I'm going to be doing your tonsillar. Just kind of right under. And then we're going to do your anterior cervical and posterior cervical. No swelling in those. Submental. That's good. Occipital, just towards the back of your head and neck. And then your supraclavicular. Okay, great. Everything feels good. Any pain or tenderness?
No.
Next thing, we're going to be looking at your trachea, so along your throat. Looking at your sternal notch, making sure everything appears midline, and then I'm just going to be feeling on side to side to feel your thyroid as well. Can you swallow? The other side. Perfect. Now I'm going to be looking at your eyes. I would typically use an ophthalmoscope, but I don't have that available, so I'll be using my handy dandy pen light. Let's make sure we're still recording. Okay. So I'm going to be looking at your eyes. First thing I'm looking at is for your red reflex. Awesome. And the red reflex is normal. White would be concerned for cataracts. Next I'm going to be looking at your pupils again. From side to side. They're equal, they're round, they're circular, they're reactive to light. Consensually and directly. Next thing I'm going to do is I'm going to have you look at the wall behind me, and then in a minute I'm going to put my finger up a little bit closer to your face, about 3 inches apart, and then I'm going to look at your pupil's response to that.
Okay.
So look off, look at my finger. Perfect. Look up again. Look at my finger. Awesome. So your pupils are constricting when my finger is closer, and that's normal. And then I'm just going to assess the external portion of your eyes as well. So looking at your eyelashes, they look great. Your square is white. And then I'm just going to look at your conjunctiva as well. So I'm just going to pull it down gently. Pink, moist, awesome. So next, I would do your ear assessment. I don't have an otoscope to do that, so we'll kind of talk about what that assessment would look like, and then I will kind of be feeling your ears as well.
Okay.
So can you pop your ears out from your little
Yes.
shower turban? Awesome. So they're aligned appropriately on your head. I'm just going to feel them in your lips as well. Attached appropriately, any pain or tenderness to your ear.
Nope.
So, important thing to note is, since you're adult, the assessment with the otoscope, we would pull back and up when using the otoscope. And with that, we would want to identify your tympanic membrane. We would expect it to be pearly gray, no signs of infection, and then potentially seeing the right light reflex in the cone of light when we're using the otoscope. But again, we don't have an otoscope today, so we're just kind of talking about what that assessment is. The fact that you don't have any pain or tenderness or irritation with your ears is a good sign. So nose. Let's talk about your nose. it is midline. I don't notice any deformities. Can you turn your head the other way so just to get another view of it as well? And then I'm going to ask to assess your patency of each nair. So I'm going to close one nair and just have you sniff. Fine. Okay, awesome. Both sides feel patent, no discomfort, no drainage or anything like that.
Nope.
And then I'm just going to look with my light again, looking at your mucous membranes, making sure I don't see any deviation with your septum. It looks great as well. So now with your throat, I'm going to have you open. If I have a tongue depressor, I could use that as well. So I'm going to be looking at your uvula, and then have you say ah, like you typically do at the doctor's office to see what your uvula does. Perfect. It's midline, it's centered. There's vibration when you're saying ah. I didn't see any like kind of angry redness for like any concern for infection. And then I'm going to assess the rest of your mouth, your tongue, your gums, lower lips, look at your teeth as well. So your lips, from an external standpoint, they're pink, they're moist, there's no dry, cracked area. Can you open your mouth and then lift your tongue up and down? Awesome. And then kind of just show me your teeth. Great. Straight. No concerns for any breakdown or anything like that. Your gums are all intact, pink as well, no bleeding, irritation. All right, let's work on your hearing. So the first thing I'm going to do is a whisper test. I'm going to get up and I'm going to stand behind you, and then I'll be putting my hand over each side of your ear, and I'm going to be whispering a couple numbers, and I'm just going to have you repeat them. Okay? Okay, so I'll start on this side.
13.
42.
42. 91.
Okay.
12. 36. 74.
Okay, awesome. Other tests that we're going to talk about, the Rhines and Weber's tests, I would need a tuning fork to do those assessments, but I don't have a tuning fork, so again, we'll just kind of talk about them. For the Rhines test, I would use a tuning fork, I would ting it to get it to vibrate, and then I would place it on your mastoid process behind your ear, and then I would move it out towards the exterior of your ear, and then I would ask you where you heard the vibration sound better. And with that, we're just making sure that you can hear the air conduction stronger than the bone conduction. That would be the normal finding. And then for the Weber's test, I would, again, use my tuning fork and have it vibrating, and then I would place it at the center of your forehead. And then I would ask you where you're hearing the vibrations best. The normal response would be that you were hearing it at a center point. If you were hearing it more prominently on one side versus the other, we would be concerned for a hearing loss on one side versus the other as well. And with that concludes our head, eyes, ears, nose, and throat exam. Do you have any other questions for me?
Nope.